Hey, Adam, can you explain how, if you go to the hospital, it's important to understand what your patient status is so that you can understand what your bill may be?
Yeah, absolutely. This is a really important specific about how whether you're on traditional Medicare or Medicare Advantage can impact your costs and your care. So when you're in a hospital as a patient, you may either be inpatient, outpatient, under observation. Don't make an assumption that just because you're in a bed somewhere that you're an inpatient. You have a right to know and you should ask. So with Medicare, if you are inpatient, that is covered under Part A. If you are outpatient or observation, that is covered under Part B. Now, here's where that can really impact your bottom line. So in traditional Medicare, your Part B coinsurance is 20%. So if you've been marked as outpatient or observation, that is the cost structure that's going to apply to your care in the hospital. So 20% may not sound like a huge percentage, but 20% of a lot of money is a lot of money. So ask whether you're inpatient, outpatient, or observation. Again, you have a right to know. If you are under observation for longer than 24 hours, they are required to give you notice. It's called a Moon document, but you're going to want to know that ahead of time. Now, your patient status can also impact what follow-up services after you get out of the hospital are covered as well. So this is really, really key. So your patient status, inpatient, outpatient observation impacts your costs as well as what services may be available to you after you get out of the hospital. And so another point here, we've talked about Medigap plans. This is another reason why many people opt for a Medigap when they're on traditional Medicare, because of that 20% coinsurance on Part B, and Medigap will cover that.
Those are all great points, Adam. Thanks for breaking that down for us. I'll use myself as an example. Recently, my husband was in the hospital for 3 days. I thought he was admitted. Nope. The entire 3-day stay was an observation status, and it did make a difference in our bill.
And Kim, that is such a great example. And it's also one more reason why it's important to have somebody with you if you can, right? Because if you're in a hospital, by definition, you're probably not feeling great. And having another person with you to ask questions like this can be really critical. So,
Right.
A family, friend, spouse, also independent patient advocates such as ourselves are available to help you out in your hospital stay as well.
Yes. And I'll just pull the curtain back a little bit more. The reason they coded it as observation is because they would have had to stop and ask for prior authorization from our insurance before admitting him inpatient. And because he was having chest pains, it was just easier and he got care faster because he was labeled as observation status. Great news is he didn't have a heart attack.
Can you talk more about some of those follow-up services after a hospital stay and how Medicare covers them?